Sandlin.
Well, thank you, Senator Johnson, and it's a real pleasure to join you at these meetings in different communities around the state, and it's good to see everyone here this afternoon. And my thanks to Bob Duffett for moderating, and our panelists, both the first and second panelists, for sharing their perspectives today. Each of you and those in the audience, you're here today because you're dedicated to making the necessary reforms in the system. You're here because you've had personal experience of a system that is broken and not working effectively for you. And so your participation today is important because, as the Senator just said, it will inform our efforts in Washington as we evaluate a number of different proposals being discussed in Congress. And our success or our failure depends on how you and every other South Dakotan will fare under the various proposals that will be debated. And so we're dedicated to making a difference for South Dakotans, their families, their businesses, and the strength of our communities in South Dakota depends on the health of our people. Unfortunately, quality, affordable care remains out of reach for far too many, and ensuring that every American has access to quality, affordable health care has never been more important. I think we're united in our goal of providing every South Dakotan with access to quality care. Many individuals are happy with what they have. They will maintain their choice of provider. I should say, though, many people are happy with the plan that they have until they have a health care crisis and then realize the limitations of the benefits of their insurance policy or deal with claims that are initially denied, even though you've paid thousands of dollars in premiums to have that coverage. Moreover, healthcare reform is really too important not to undertake. The Medicare program costs are unsustainable because of skyrocketing healthcare costs. Over the last decade, as Senator Johnson mentioned, premiums for American families have doubled, and deductibles or out-of-pocket expenses have grown out of control and essentially have given people catastrophic coverage. So many small businesses that offer health insurance or would like to find that because healthcare costs are skyrocketing, more and more small businesses aren't able to offer healthcare coverage, and then it becomes a competitive disadvantage. Now, the President has proposed a plan to modernize America's health system based on 8 principles. As you know, the President hasn't tried to dictate to Congress the various details of the plan, but he's outlined the following principles that he would like to see. Protecting families' financial health. We have far too many medical bankruptcies in the state and in the country today. Making health coverage affordable, aiming for universality, providing for portability of coverage, guaranteeing choice, investing in prevention and wellness, and improving patient safety and quality of care, and maintaining long-term fiscal sustainability. The administration's budget proposal earlier this year suggests specific ways in which to finance reforms, and Congress will evaluate those proposals as well as others on the table. But these include reducing overpayments to the Medicare Advantage private plans, reducing drug prices for consumers, and improving care after hospitalizations in order to reduce readmission rates. This goes to some of the inefficiencies and low-quality, high-cost concerns that we have in some parts of the country in some of our public programs. But Congress is now addressing the President's first among equals and his priorities for his new administration. That is health care reform, and you're going to see a great deal of activity in the House and the Senate in the coming weeks. In fact, I think it is the hope and the expectation that both the House and the Senate will vote on each of the respective chambers' health care reform bills before we are back in our districts and our states during the month of August. Your participation here today is timely. It can't be overstated in terms of its importance. And while we haven't agreed on specific details of the policies between the House and the Senate, I do think that you will see programs that are proposed that will not add to the deficit, that will be accompanied by very difficult choices and how we find savings in the system and other proposals to make sure that we pay for reform. So this is an opportunity for all of us to share information and perspectives with one another And I look forward to hearing the personal experiences of our first panel, as well as the perspectives of our providers and leaders within the healthcare delivery network here in South Dakota with regard to the proposals that are currently being evaluated in Congress. So thank you again to all of you for being here.